Good morning to everyone. I am Sajida, Emmanuel Arisa College of Nursing. Today we are discussed about the class second year BSc Nursing 4th semester Adult Health Nursing 2 Unit 3 Urinary Disorders, the diagnostic procedure of treatment of hemodialysis. First we have discussed about the introduction of hemodialysis. Hemodialysis is a treatment to filter waste from water from blood as kidneys did when they were healthy. Hemodialysis helps control blood pressure and balance important minerals such as potassium, sodium, and calcium in blood. Hemodialysis can help to feel better and live longer, but it's not a cure for kidney failure. During hemodialysis, blood goes through a filter called a dialyzer outside the body. The dialysis machine pumps blood through the filter and returns to the blood in the patient's body. Next, we can see about the definition of the hemodialysis. Hemodialysis is the most common renal replacement therapy used to end-stage kidney disease and kidney failure. Dialysis remove excess fluid and waste products and chemical and electrolyte balance. Hemodialysis is the most common renal replacement therapy used with end stage of kidney disease and kidney failure. Dialysis remove excess fluids and waste products and chemical and electrolytes balance. Hemodialysis is a medical procedure to remove fluid and waste products from the blood and to correct electrolyte imbalance. This accomplished using a machine, and a dialyzer also refers to as a artificial kidney. Next, indication of hemodialysis. AKI, acute kidney injuries. CKD, chronic kidney disease. Encephalopathy, neuropathy, uncontrolled hyperkalemia. Hyperkalemia means increase the potassium level. Normal potassium level 3.5 to 5.5 milliequivalent per liter. More than 5.5 milliequivalent per liter is called hyperkalemia. Principles of hemodialysis: diffusion, osmosis, and ultrafiltration. Have three principles. First one is the diffusion, osmosis, and third one is the ultrafiltrations. Then vascular access, permanent type. They have two different types. One is the permanent type, another one is the temporary type. Permanent type is divided by two: AV fistula and AV graft. Temporary type, hemodialysis catheter, mainly subclavian, jugular, and femoral catheter. Second one is the subcutaneous device. Vascular access is divided as two: permanent type and temporary type. Permanent type, again they have to divided to AV fistula, AV graft. Temporary type, hemodialysis catheter, mainly subclavian, jugular, and femoral catheter, and subcutaneous device. Permanent vascular access, first of all discussed about the AV fistula. An arteriovenous fistula. AV fistula is an internal access surgically created by a vascular surgeon using the patient's own blood vessels. And arteriovenous fistula. AV fistula is an internal access surgically created by a vascular surgeon using the patient's own blood vessels. AV fistula is created by adjoining artery and vein. Two blood vessels are joined in a side-to-side or end-to-end connections. The diversion or arterial blood into the vein causes the vein to become enlarged, distended, and prominent, allowing placement of large gauge needle for the dialysis treatment. Axis will be able to deliver a blood flow of 300 to 500 ml per minute. Maturation all occur when there is dilation and thickening of the venous segment occurred. The AV fistula can be placed on either upper or lower arm. The radial artery and the cephalic vein in the lower arm, brachial and cephalic vein in the upper arm. AV fistula can be placed in either the upper or lower arm, the radial artery and the cephalic vein in the lower arm, and brachial and cephalic vein in the upper arm. Venography allows identification of appropriate vein and helps to rule outside that are not suitable for use. Doppler flow studies may also be used to venography is not available. AV fistula may take up to 4 months or longer to mature, enough for cannulation. AV graft, generally called as arteriovenous graft. When a patient is not a candidate for native AV fistula or vascular graft is substituted, it can be biological or synthetic material. Graft material is implanted subcutaneously into either forearm or upper arm. The graft bridges an artery on one end and a vein on the other end. The blood flow is from artery to vein with the AV graft. The graft may be placed in several configurations, example straight, lobed or curved. Duration taken for maturation is 2 to 6 weeks after graft placement. This is arteriovenous graft. Then advantages. First discussed about the advantages. Large surface area for cannulation, easy to cannulate, little time required for maturation, variety of shapes and configuration, easy for surgical implantation. Disadvantages: higher rate of infection, may reject graft materials, higher rate of infection, stenosis at the venous anastomosis from the intimal hyperplasia, no development of collateral circulation. Temporary vascular access, indication and access for acute dialysis, plasmapheresis, patients waiting for kidney transplantation, patients receiving venous continuous renal replacement therapy, patients on peritoneal dialysis requiring temporary hemodialysis because of peritonitis. Temporary vascular access, hemodialysis catheter inserted into the subclavian catheter, jugular catheter, femoral catheter, subclavian catheter, jugular catheter and femoral catheter, and second one is the subcutaneous device. Hemodialysis catheter, subclavian vein, jugular vein and femoral vein or the vessels accessed for using the double lumen catheter. Hemodialysis catheter has replaced to the AV shunt for patients receiving immediate chemodialysis. A catheter designed from HD may be inserted into the subclavian internal jugular vein or femoral vein. The lumen of these catheters are much smaller than the placement, access and more time is required for complete each dialysis 4 to 8 hours. Complication: pneumothorax, hemothorax, air embolism, bleeding, retroperitoneal hemorrhage from the puncture of the vein during insertion. Subcutaneous device that implanted beneath the skin. These devices are composed of two small metallic pods with attached catheters that are inserted into large central vein. The ports of subcutaneous device have internal mechanism that opens when needles are removed. The blood from one port flow from the body to the HD machine and return via the other port. This is the procedure. First, the red line, patient, then clean blood, air trap detector. First, removed blood for cleaning, then the blood pump, arterial pressure monitor, then blood is the pump, heparin pump to prevent the clotting, then inflow the pressure monitor used to dialysate, first dialysate, saline solution, dialyzer, venous pressure monitor, air trapping and air detector, clean blood goes to the patients. The dialysis solution, bicarbonate solution, concentrated acidic solution. Bicarbonate solution, sodium bicarbonate 600 grams, sodium chloride 335 grams, sodium chloride IP 183 grams, potassium chloride 5.50 gram, calcium chloride 8 grams, magnesium chloride 2.75 gram, acetic acid 9 grams, dextrose monohydrate 38 gram, purified water 1 liter. Complications of hemodialysis, dialysis, disequilibrium syndrome, infectious disease, HIV, hepatitis infections. Pre-dialysis care, assess the vital signs including orthostatic blood pressure, lying, sitting and standing position. The blood pressure also they have to abnormal, apical pulse, respiration and lung sounds also monitor. Record weight changes or effective indicators of fluid volume. Anyway, they have to carefully monitor the weight and document the weight of the patients. Assess vascular access site for a palpable pulsation or vibrations and audible bruit and for inflammation, infections and thrombus formations. Alert all personnel to avoid using the extremity with the vascular access site for blood pressure or vein puncture. This procedure may damage vessels and lead to failure of the AV fistula. Post-dialysis care, assess the document vital signs, weight and vascular access site condition. Assess and document vital signs, weight and vascular access site condition. Rapid fluid and solute removal may lead to orthostatic hypotension, cardiopulmonary changes and weight loss. Monitor blood urea nitrogen level, serum creatinine level, serum electrolyte level and hematocrit levels between the dialysis treatment. Monitor blood urea nitrogen level, serum creatinine level, serum electrolyte level and hematocrit levels between the dialysis treatment. Assess for dialysis disequilibrium syndrome with headache, nausea and vomiting, altered level of consciousness and hypertension. Assess the nausea, vomiting, muscle cramp and seizures activities. Assess for bleeding at the access site. Use standard precautions at all times. If transfusion is given during the dialysis, monitor possible transfusion reactions. Provide psychological support and listen actively. Refer to social service and counseling as indicated. Clients with renal failure may need additional support device to help them to adapt and relieve them their disease. Conclusion: hemodialysis is used for clients with acute or chronic renal failure, fluid and electrolytes and imbalances, etc. It is usually the treatment of choice when the toxic agents such as barbiturates after an overdose needed to be removed from the body quickly. In this process, the client's toxin-laden blood is diverted into the dialyzer, cleaned and returned to the client. Thank you. Thank you everyone.